Notice that Ramsey really wasn't gaining weight. Swelling wasn't sudden. It was the end result of disease. And they're known for their... And Spur is a sulcata tortoise, brought in for clicking respiratory sounds. Behind every video clip you're about to see, there's a patient, a problem, and a decision that had to be made in real time. Some of these moments are subtle, some pretty unusual, and some happen much faster than you'd expect. But each one has something important to teach us. Hello, have you ever seen an American buff goose? You're about to. Meet Harvey. Harvey is a handsome American buff, which is a heritage breed in the U.S. They're still considered a pretty rare breed, one of our oldest breeds of geese, and they're known for their sweet, loving temperaments. These are actually great pet geese, and Harvey is a good example of that. Very sweet, very engaging, but he also is a bit of a guard goose at home. And that's pretty typical with geese. If you're considering getting a goose, make sure you can house them appropriately. They should be housed on pasture. Not easy to do in Arizona. Harvey's situation is pasture-based with ponds, and that's very important. Geese have to actually be able to dunk and submerge their nostrils to clear their nostrils, and all waterfowl should have access to a pond that's kept clean and maintained. And the other thing to consider is geese are loud, regardless of the breed. They will honk at anything they consider a threat or just for sheer joy. And so if you have a goose, you need to be aware of what your homeowner's environment has as far as rules, or what your neighbors may consider a problem or a pest, because a lot of people will get into issues with loud geese. But having said that, if you have the right environment and a pasture situation, then getting geese is a great idea. I do make sure that they're cooped at night. They should always be housed at night away from predators. In this area we do have coyotes, and while the coyotes may be somewhat threatened by them, we never know if they're hungry enough, if it may be a problem. So we make sure that they're in at night. And in Arizona we have problems with feet in geese, pododermatitis. They're big-bodied animals with relatively small feet, and we'll get a lot of foot sores in geese. And so in Arizona, we often have rocks and hard dirt or packed dirt, not an appropriate environment. A nice soft pasture and ponds will protect their feet. These owners have actually cut their grass much longer to have more cushioning for their geese, and all of them have beautiful, healthy little footies, including Harvey. And then it's appropriate to have them on a waterfowl diet, not a chicken diet. So very frequently we'll see nutritional problems, particularly in young growing animals, because they're kept on chick food. And that's not going to be appropriately balanced for your geese or your waterfowl. So be very cautious and make sure they have the right diet. But if you're considering a goose, consider the American buff. Wonderful breed, beautiful animal, very sweet and loving. Well worth a second look. Newly adopted, and he came with medications. Always a bad sign. This sugar glider's facial swelling wasn't sudden. It was the end result of disease hiding in the teeth and the jaw. The owner noticed swelling along the jaw that wasn't improving on the medicines provided. The activity was only slightly reduced, and that's very typical for this species. Sugar gliders are extremely good at masking discomfort and continuing to function despite ongoing disease and pain. When facial swelling finally becomes visible in a sugar glider, it usually means the body has been compensating for a long time, and that compensation has reached its limit. At first glance, facial swelling often looks like a simple abscess, something acute, something that just happened. But in sugar gliders, it's rarely a surface problem. More often, it's the point where the disease inside the mouth and jaw has progressed far enough that it can no longer stay contained. To understand why that happens, you have to understand how sugar gliders' teeth are built. Sugar gliders have diprotodont dentition. Their lower incisors are elongated and paired forward, and those teeth aren't used for chewing, they're used for grooming and manipulating food. The cheek teeth are sharp and narrow, and they're designed to slice and shear softer foods rather than grind. Medically, the most important feature, unlike dogs or cats, dental disease in sugar gliders rarely begins with obvious tartar buildup, fractured teeth, or even visibly abnormal crowns. The enamel can look pretty normal, while the bone supporting the tooth is quietly and consistently weakening under the teeth. This is where diet becomes central to our story. Sugar gliders require a very specific nutritional balance: consistent high-quality protein, an appropriate calcium to phosphorus ratio, controlled limited sugars, and low iron intake. Common feeding patterns we see are fruit-heavy diets, excessive treats, lack of calcium, inconsistent protein sources, or incomplete homemade plans. And these slowly erode bone health over time. When bone density decreases, the teeth lose stable anchoring. Microscopic movement develops at the tooth roots in the jaw. That movement allows bacteria to migrate deeper, tracking down the root and into the jaw. The progression is silent from the outside, and the mouth may still look normal from the inside. However, infection may already be present within the bone. Over time, this can progress to actual tooth root abscessation, osteomyelitis, bone infection of the mandible or the maxilla, and eventually visible facial swelling. What looks sudden is really actually late. At this stage, facial swelling isn't just a cosmetic change, it's a signal that the jaw and the surrounding tissues are involved. For a sugar glider presenting in this way, our differential diagnoses include dental disease with apical infection, jaw osteomyelitis, abscess secondary to trauma or bite wounds, metabolic bone disease with secondary dental instability, neoplasia, and less commonly, sinus or isolated soft tissue infection. These conditions can look very similar externally. You cannot reliably tell them apart based on appearance alone. That's why diagnostics are essential. For this patient, we're performing a sedated oral exam because awake exams simply don't allow adequate visualization in these little tiny guys that move quickly. We're obtaining skull radiographs to evaluate tooth roots, alveolar bone, and overall jaw integrity. And we're running a CBC and chemistry panel to assess for infection, inflammation, and metabolic abnormalities that may be contributing to the disease, including calcium levels. Those diagnostics don't just tell us what's wrong. They tell us how long it's been wrong, how extensive it is, and what kind of treatment plan this patient actually needs for this disease process. In sugar gliders, dental disease doesn't announce itself at the teeth. It announces itself when the jaw can no longer compensate. Facial swelling feels like the beginning of the story. In this species, it's usually the moment the hidden part finally becomes visible. And that's why diet, early evaluation, and attention to subtle changes matter so much in these little sugar gliders. Long before anything looks wrong on the outside, it's already brewing on the inside. We're showing you Spur today, and Spur is a sulcata tortoise. They're also called African spurred, so he's aptly named. He is mildly sedated right now, but he is starting to wake up. Yeah, a little bit. He's a little mad at us, but he's a good boy. So he's a 100-pound sulcata tortoise, and it's really important with your sulcatas. You'll often get them as these little tiny baby hatchlings, and they very quickly get to this size. So if you are planning on getting a sulcata or African spurred, you need to realize they're going to get big, and really you need almost to house them like a horse. So you need a large pasture. In Arizona, we have problems with them on rocks because we have rocks everywhere and they tend to eat them, which can cause a problem. But Spur is in today because he is showing neurologic signs. So his balance is off, he's wobbling, having trouble moving, he is still eating. And it started shortly after his grass yard was fertilized. And so the concern is toxicity from the fertilizer. So we're running some labs on him to make sure there's nothing else going on, and more importantly, to see what the kidney and liver values look like, and then doing supportive care while we wait on those results. He is stable and he's maintaining well, but we're just doing a workup to see exactly what is going on and make sure there's not another primary cause. And then, of course, environmental cleanup and removing him from the source was an important part of that. Another thing, I'm sorry, little man. Another thing with these big guys to be aware of is if you're in the vet field or veterinarian, very, very difficult to examine or handle them, even when they're smaller than this. They're very strong. When they're not sedated, they do what we call armor up. So they'll put their head in and their little arms will come forward, and you really can't do anything with them. So these large ones almost always have to be sedated in order to get even basic diagnostics or treatments done. But as you can see, he's doing well with sedation. He's starting to wake up, and we're going to get him home in just a little bit. We have a double ferret for you today. So we're going to focus mainly on Ramsey, our littlest one here. This is a follow-up video on Ramsey. This is Brownie, who you can see, they're the same age, about 5 months, and you can see Brownie's grown faster. He's quite a bit heavier, a lot more rambunctious, and is willing to run right off this table in an instant. So Barbara, here's Brownie. So Ramsey, you can see, is much thinner. And on the first video, we pointed out that the owner had gotten these guys from a big box store and noticed that Ramsey really wasn't gaining weight. He was a lot quieter, and he was grinding his teeth very frequently. And on the follow-up exam today, he's actually already started to gain some weight. His hydration's better, and he's a little bit more spunky. So we did do diagnostic testing on Ramsey, and he came back with quite an assortment of issues. He has Giardia, a parasite that can cause diarrhea. It can infect all mammals. He also tested positive for ferric enteric coronavirus, not your standard corona, a ferret version, that causes a lot of bowel problems and probably explains the tooth grinding. And he tested positive for Helicobacter, which is a bacteria that can cause ulcers, stomach ulcers in ferrets, and is fairly common in them. So we are treating him for all of these issues and doing still a lot of supportive care. We've got him on some duck soup for more protein, increased hydration. He's just pretending to be sick right now. He was actually just bouncing off. There you are. He was just bouncing all over the exam room. But he is still weaker than he should be, and we're still working on getting even better hydration on him. His stool is not yet normal. But the good news is we expect him to be normal and expect him to fully recover. And even better news is he got a wonderful owner who recognized a problem and had it researched to determine what the actual problem is and how we can best treat it. And so we expect a full recovery for this little bug. And his brother's busily exploring the exam room. This juvenile ball python was brought in for clicking respiratory sounds. And catching this early, it completely changes the outcome. He was recently purchased from a pet supplier, and otherwise he is still acting normal. He's still active, he's still eating, which is exactly how early respiratory disease often presents in snakes. Did you know snakes can cough? Yes, they cough. And yes, it sounds like a cough. So these clicking or popping sounds the owners noticed are often the earliest sign that something is irritating the airway or the lung. A snake's functional lung, only one, the other is vestigial, is a long, narrow tube that runs forward in the body. The front portion handles gas exchange, while the back acts more like a kind of an air reservoir. So when inflammation or mucus affects the front segment, airflow is compromised very early. If that process continues, inflammation can spread deeper into the lung, interfere with gas exchange, and progress to pneumonia or chronic lung changes that are much harder to reverse. Catching this early allows, catching this early allows appropriate diagnostics to confirm the cause and guide the correct treatment. When owners act early like this, the prognosis is significantly better. Don't ignore the subtle signs. They can make a difference in the long run. If this is for you, consider subscribing. Thank you.